Welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Joining me today is Brittany Bond with Helping Hands Clinic. Welcome, Brittany.
Thanks, Paige.
And before we started shooting, we were talking about, I think most people know you offer primary medical care and a pharmacy.
Yes.
But there's so much more.
Yes. So we have our primary care clinic and our pharmacy for uninsured adults in Caldwell County who meet our income requirements. But we also do so many other things, and I'm really excited to talk about those today. So the first program I want to share about is our dental program called Project Smile. So Project Smile is for anyone in the community who is uninsured and who meets our income requirements and is in need of dental care. So through this program, which is a collaboration with our clinic, with the Caldwell County Health Department's dental service, and then with other free clinics in our region, we can offer extractions, we can offer urgent dental care, we can offer dental hygiene visits, and we can offer restorations, so fillings and things like that. And there may be a slight wait for some of the services that aren't emergent, but if someone comes to us with an infection, with pain, we can usually have them seen within 1 to 3 business days through that program.
And that's amazing because I remember it wasn't that long ago that we didn't have any dental options for adults. I mean, they were very few.
Yes, there have been some services throughout, the history of our community where there have been some low-cost dental options, but we are so incredibly grateful to be able to offer this. We actually applied for grant funding through the Blue Cross Blue Shield of North Carolina Foundation to be able to offer this service, and it's been amazing. So we can provide these services free of charge for the patients who financially qualify and who are uninsured. So, and it's a very simple process to be referred. You can stop by the clinic or you can call the clinic and just let us know what your need is, and we can do an assessment and get that process started.
And your dental health, I mean, I'm no medical person, but your dental health impacts your overall health.
Yes, it does. Definitely. Dental health is important to your overall health, and it's important for you to be able to have access to that, and so many people don't, and so many people don't have dental insurance or health insurance in general, so being able to offer this is really important.
And you mentioned another service that I had no idea you offered, and it was eye care.
Yes, so all of our enrolled patients at Helping Hands Clinic have access to a free diabetic eye exam. So our patients who have diabetes, we also have access to a low-cost eye exam for Helping Hands patients through a partnership with Greystone Eye. And also we have had partnership in the past with Dr. Wineset's office. So we've been incredibly blessed in this community to have providers who are willing, to help with folks who maybe don't have the money or don't have the insurance coverage to have these needs met. So we're incredibly grateful to be able to do that.
And and that's pretty incredible to me because I take for granted that because I have vision insurance, but there's a lot of people who don't and who just walk around with a vision problem.
Exactly. And that service is specifically for Helping Hands patients, but the other services that we've talked about so far today and in the future, you do not have to be an enrolled Helping Hands patient. You just have to meet the eligibility criteria. So if you're uninsured and you're not enrolled with Helping Hands, we can go ahead and help you with these needs. Something else I want to mention, we talked about dental, we've talked about vision appointments. We also have a partnership with the service to provide low-cost eyeglasses for our patients. So it's pretty amazing. So this is for anyone in the community who's uninsured, and anyone who also for folks who have Medicare Part A and B that doesn't have lens coverage and don't have access to glasses through their insurance coverage through their Medicare, they can come and access this service as well. So it's a $10 pair of lenses and frames. So
that's an incredible price.
Yes, it really is. It really is. You just have to have a valid prescription, and if you don't have access to vision care, then we can help you find resources for that, so that you can get your prescription and get in and get your glasses. So.
And I'm just going off the top of my head here. Another one of your services would be mental health care.
Yes, and that's another program that we offer in collaboration with a provider in the community, and Quinette Burnett, who's been here with us before.
Yes.
So we are able to offer free counseling services for not just Helping Hands enrolled patients, but again, anybody in the community who meets our financial eligibility criteria. And we can offer this on site at the clinic, or Quinette sees our patients at her office as well. So this is an incredible resource. Mental health resources are thin on the ground. I mean, not just in our community, but across North Carolina. And so this is something that we're really, really grateful to be able to offer. We've had several local grant funders who have supported this effort and make this possible for our community. So we're really grateful for that.
And a lot of times I think adults overlook their mental health.
Oh yeah, certainly. And well, and especially if you look at, I don't have insurance coverage to pay for it, and I have to buy groceries or pay my light bill or do all these things. Your mental health is not necessarily something that's going to come first when you're looking at your list of expenses. So that's why we're really, really grateful to be able to offer that. One other thing I don't think we talked about is our pharmacy. So we know that's one of the pillars of the services that we offer at Helping Hands. But the pharmacy isn't just for enrolled Helping Hands patients. Again, anyone in the community who meets our eligibility criteria, who's has low income and is uninsured, can have their medications filled at our pharmacy. So we're a limited licensed pharmacy, so we don't dispense controlled medications, but your insulin, your blood pressure medication, your inhalers, and then sometimes any life-saving medication that supports your chronic illnesses and improves your quality of life, we can dispense at our pharmacy.
So there's cholesterol meds, and you named a whole bunch, blood pressure.
Yes, antibiotics, all those kinds of things we can dispense from our pharmacy. And those prescriptions are free for our patients. We always, if someone is able and feels led to make a donation to support their care, that's wonderful, and a lot of our patients do. But that's not something that's ever going to be a barrier to receiving care or receiving your medication.
Since you mentioned making a donation, how can people make donations to Helping Hands?
Yeah, it's actually really simple. You can send a donation by mail, which is a very simple way to do it. Or we have you can go to our website, which is helpinghandsclinic.org, and there is a donation portal that's available there, and you can make a really simple online donation to us, and that supports our operation, our ability to see patients in the clinic, our ability to purchase medications, generic medications. We access name brand medications through the patient assistance programs through the drug companies that we work with, which is an arduous process if anybody has ever tried to do that. So we have a full-time staff member who that's her role, is to complete those medication orders and make sure our patients have what they need. But our generic medications, we have a budget with the community pharmacy at Caldwell UNC Healthcare, but we also have to purchase some of those. So donations help support that as well.
And when you said Caldwell UNC Healthcare, I thought about you enroll your patients.
Yes. Yes, so
and you can explain that, because I'll get all the words wrong.
So our enrollment process at Helping Hands includes dual enrollment with UNC Caldwell's Charity Care program. So, and I don't know if any of our viewers have ever completed that application before. It's kind of a bear, it's several pages. That's something that we do as a courtesy as part of our Helping Hands enrollment. So any patient who's eligible and qualifies to be cared for at Helping Hands is also eligible for charity care. And that basically allows us to navigate that patient through the UNC health system for any services that we don't offer in-house at the clinic. So if there are medical procedures, specialty visits, surgical visits that they need to have that we can't do in-house, we can move through UNC's system, and that patient has a really affordable option for that care.
As we've been talking today, I've been thinking about how it's really caring for the whole being.
Oh yeah, certainly, and that's something that over the years at the clinic that has really sort of been a focus, is just to look at our patients and talk to our patients and find out what do we need, and then to build partnerships to make that happen. And so that's how we get dental care, that's how we get mental health. I mean, that's how we have all of these pieces of the puzzle that we can offer at Helping Hands.
There's another thing that's common that when you're looking at donations,
Yes.
you have a wish list. I don't know if you call it a wish list. I'm not sure
It
what
is.
you call it.
We do call it a wish list. Our wish list primarily right now consists of things that help us operate in our office. We need copy paper. We always have things like peanut butter crackers for our diabetic patients, bottles of water for our patients, and then over-the-counter medications. So like your Tylenol or acetaminophen, your Advil or ibuprofen and Aleve, those kinds of things we try to keep on hand so that if our patients come and need them, that we have access to them. We have our full wish list. Again, it's at our website. And then you could also call if you were interested in donating some items that we need at the clinic. And we have a couple of groups, church groups, civic groups, some just wonderful individuals who bring us things every month, and it really helps us to keep our costs down and to make sure that our funds are spent caring for patients.
And I will say that if you follow Helping Hands on Facebook, you may see some different needs that they have you may be able to meet. I mean, it may be that a single patient needs this,
Yes.
which the patient's never named and you don't even know that, but the wish is
Exactly.
for a durable medical equipment.
Yes, and we do take donations of durable medical equipment as well. We have limited space, so we try to take the things that we know that our patients need frequently. If not, we refer those folks to our friends at Yokefellow, or if we know that it's something that hospice, that a Morum could use, that we send our friends to those folks as well. But that's something that we do. We use Facebook as a great tool. We also have a newsletter. If anyone wanted to learn more about what we do, we can add you to our newsletter list. Where we share needs like that and success stories, which is just my favorite thing to do. So recently, actually, our medical provider came to me and shared that we have had an influx of new patients. Medicaid expansion happened in December, so quite a few of our established patients were eligible for Medicaid, which was a wonderful thing. And so we've transitioned those folks to new providers that they can use their Medicaid with, but we haven't seen a slowdown in the number of patients that are coming to us seeking enrollment at the clinic. So with these new patients, our provider came to me and shared that she had 3 patients who she was able to start the process for early diagnosis of cancer. And these were all folks who had not had a medical home previously, were not receiving regular medical care, who connected with us through community outreach, through word of mouth. They just learned about our services and were able to come in and would have probably not otherwise been seeking medical care. None of them were terribly symptomatic. It wasn't anything that was a really obvious issue, and all 3 have really positive prognoses because we were able to catch that early. So,
and that's really what Helping Hands is about.
Yes, 100%. Improving people's health, giving people access to a medical home, and making sure that they have the resources they need to care for themselves. So.
And I think the key word here is uninsured.
Yes.
Because we have so many people in our community who are uninsured.
Yes.
It may be this person who works at or owns a small business.
Yes, certainly. And we see a lot of patients who are either small business owners or self-employed or work for small businesses who either can't afford the insurance that's available to them or who don't have access to insurance with their employer. So we are an alternative to not having insurance at all and not having any kind of resource. We can be your medical home and can help you with the resources to find low-cost care and with charity care and all these things. And I'm just it just makes me really proud that we're able to do that for our patients and keep them healthy, keep them at work, taking care of their families. So
that's really awesome. Brandy, is there anything else we need to cover today? Because I feel like we've been everywhere.
I know, so we jumped all over the place. I kind of like this. This was nice. Just that we are accepting new patients. We are also looking right now for additional medical provider coverage to increase our capacity to be able to offer more hours at the clinic and more visit times. So if there are any providers out there who are interested in our mission and would like to learn more, we'd be happy to talk to you. And if you are uninsured and need medical care, we're a resource and we want to be there to help.
Awesome. Thank you for leading the charge at Helping Hands and all that they do, all that's done through the clinic, because it's amazing stuff.
Thank you very much. I appreciate it.
And thank you for watching Caldwell County Today.